Once again, welcome back to the program. At this segment, we will talk about Alan Glasser, who is a pharmacist. He comes here quite often and important issues that we talk about. आज ਅਸੀਂ ਨਾਲ ਗੱਲਬਾਤ ਕਰਨੀ ਕਿ ਫਾਰਮੇਸੀ ਦੇ ਵਿੱਚ ਕੀ ਸਿਰਫ ਦਵਾਈਆਂ ਹੀ ਮਿਲਦੀਆਂ ਨੇ, ਬਹੁਤ ਸਾਰੀਆਂ ਕਾਮਨ ਏਲਮੈਂਟਸ ਜਿਹੜੀਆਂ ਨੇ ਕੀ ਉਹਨਾਂ ਦਾ ਇਲਾਜ ਫਾਰਮੇਸੀ ਚੋਂ ਲੱਭਿਆ ਜਾ ਸਕਦਾ ਹੈ। ਆਓ ਇਸ ਸੰਬੰਧ ਵਿੱਚ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਐਲਨ ਗਲਾਸਰ ਨਾਲ। Welcome to the program.
Thank you very much, Harpreet.
Thank you once again. So Alan, you have been a pharmacist for a long time, and generally when we go to a pharmacy, our major objective is to get some medicine and then we come out. Now over the years things are changing. In your pharmacy, other pharmacies also, what kind of services can the people get for common ailments, like somebody is having a knee pain or somebody is having some other major issue? So what kind of benefits can they get from there?
That's a good question, Harpreet. For the common problems that people have, say if you twisted your ankle,
right,
and you don't, it's going to be supported. Sometimes you'll need some external support.
Mm-hmm.
Well, at Mark's Pharmacy, 80th and Scott Road,
mm-hmm.
we have little things like this. You don't have to get that old-fashioned long 5-yard long ribbon of tensor bandage.
Right.
You can now get this one specially made.
Mm-hmm.
You can put it easily
only
into
on
a
the
figure
ankle.
eight.
Okay.
And put it on your ankle
Mm-hmm.
and help support your body.
Right.
There are simpler things, easier to slip on.
Mm-hmm.
Okay. There's one common problem: an injured ankle.
Right.
Another common problem: work up the body. Say you injured your knee because you twisted it.
Right.
You can slip. We had icy period of time.
Mm-hmm.
You slipped and fell. Well, there's a very simple knee support. It comes either with a patella stabilizer in here or not.
Right.
So your kneecaps in there and stabilized or not. It's very simple to slip on,
Mm-hmm.
and it's going to help. Number one, keep the knee warm. Number two, put some compression on it if
Right.
there's any swelling.
Okay.
And number three, it's going to stabilize it.
Mm-hmm.
So really easy to slip on. And if we don't have your size in, we can take a measurement and it'll be there the next day at the latest.
Right.
So the next step, what else can you injure? Common injuries.
Mm-hmm.
One, people complain of carpal tunnel.
That's right. Yeah, and a hand is, it's paining here. Quite a lot of elders complain about
That's
that.
right. Now, it's usually it doesn't matter. This happens to any age.
Right.
People who are cashiers and doing repetitive strain injuries,
Mm-hmm.
people who constantly are using the same motion in your hand.
Right.
We used to have to hammer nails and
Mm-hmm.
hammer guns, but if you're twisting something, especially women, when they're cooking and they're chopping and they're cutting and they're doing this repetitive
Mm-hmm.
injury, it can injure your hand.
Right.
So we have this brace
Mm-hmm.
that you put on your hand,
Right.
and overnight it will stop it from moving.
Okay.
So that's the whole
it
purpose
gives that
here.
support.
This is a support, and this is a left-handed one. You just strap it
Right.
on at night,
Right.
and now you make sure that the muscles
Okay.
are resting all night,
Right.
because your hand can't move back and forth.
Okay. Right.
Very simple. Yes, it's around 100 years, but some people don't realize there's simple things. You don't necessarily need a drug to take care of the problem.
Right.
If you just get a little support, we can help you with your wrist problem too.
Wonderful. So apart from that, as we age, your legs are not stable, you keep on shaking, and especially our elders prefer to take a cane with them for walking. But many times they forget, or those canes are quite heavy. With the change in time, with the change in technology, do we have now some kind of canes which are easy to carry on and give some more stability?
That's right. That's a great question, Harpreet. So yes, we do have this.
Uh-huh.
At Mark's Pharmacy, 80th and Scott Road. We carry a line of these canes.
Okay.
Number one, they're nicely colored instead of being black or white.
Okay.
Number two, they're totally collapsible.
Mm-hmm.
They're held together with a elastic.
Right.
So when you open this up, it automatically straightens
But
up.
are they stable? Do they have
Oh.
that stability?
They have the strength. There's no
Okay.
problem. They
Right.
stick right together.
Okay.
Not a problem. Again, it solves the problem of forgetting your cane, because how many people I've seen, they even come into the store
Right.
and they leave their cane on the counter and they walk out because they're
They forget.
okay, except they get, there's a period of weakness and then they don't have their cane.
Now, especially with the cane also, how to make sure that you're carrying the right cane, because many a times the sizes, it depends upon your height and all that.
That's
so
right.
how to measure, what should be kept in mind?
So when you have a cane, it always has something adjustable. A little dot you push in and go up and down.
Right.
The correct height of the cane is where it breaks your wrist. So when you stand up straight,
Right.
and your cane only comes to where your wrist is as you're standing up straight, that is the correct height.
Okay.
If it's higher or it's lower, it's uncomfortable, I have seen, unfortunately, many clients who walk in the doors,
Right.
Mark's Pharmacy, 80th and Scott Road, they don't realize they're carrying the cane wrong. They're uncomfortable. They're off balance.
Right.
The other thing about a cane is you always, if you're weak in your right knee, you must use your left hand. It's
Okay.
always the opposite side.
Oh,
Now, the reason for that is very simple. When you stand up,
right.
you want 50% of your weight on the weak side,
Right.
50% in your hand.
Okay.
That's the secret. And then you
Right.
can be straight when you walk.
So, for example, if I'm having a pain in my right leg, I should carry a cane in my left hand.
That's correct.
So to give it a balance and to have the better coordination.
That's correct.
Okay. And also towards the end, people have strokes also. And when you have stroke, again, your body is not stable. Many times we have seen that people carry normal canes and they sometimes fall also.
That's right. So they do, for people, unfortunately, who've had a stroke or are very unstable, we make canes with 4 feet. Now,
Okay.
this is actually a small version. There's a larger version where the feet come out even more.
Okay.
So the stability
Right.
is really high now. It's really difficult to be unstable
Okay.
with a cane such as this. And it is an option for you. You can come into Mark's Pharmacy, 80th and Scott Road. We will happily size it correctly because then, remember, that top of this cane is going to be no higher than your wrist.
Okay.
So get-
Wonderful. That's good information what you're giving, that apart from the drugs, there are many other aids available which you can
Yes.
use and get relief from pain. Thank you very much for your time.
Thank you.
ਥੈਂਕ ਯੂ। ਸੋ ਅੱਜ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ, ਐਲਨ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਹੈਗਾ ਕਿ ਜਿਹੜੇ ਵਿਅਕਤੀ ਦਰਦਾਂ ਤੋਂ ਪੀੜਤ ਨੇ ਜਾਂ ਹੋਰ ਉਹਨਾਂ ਨੂੰ ਕੋਈ ਚੈਲੰਜਸ ਨੇ, ਖਾਸ ਤੌਰ 'ਤੇ ਬਜ਼ੁਰਗ ਜਿਹੜੋਂ ਕੇਨ ਦੇ ਨਾਲ, ਜਿਹੜੇ ਸੋਟੀ ਨਾਲ ਤੁਰਦੇ ਨੇ, ਉਹਨਾਂ ਵਾਸਤੇ ਇਹਨਾਂ ਨੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈਗੀ ਹੈ ਕਿ ਜਿਹੜੀ ਵੀ ਤੁਸੀਂ ਸੋਟੀ ਲੈਣੀ ਹੈਗੀ ਹੈ, ਪਹਿਲਾਂ ਤਾਂ ਅੱਜ ਮਾਰਕੀਟ ਦੇ ਵਿੱਚ ਤੁਹਾਨੂੰ ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਦਿਖਾਇਆ ਕਿ ਫੋਲਡੇਬਲ ਵੀ ਮਿਲ ਜਾਂਦੀਆਂ ਨੇ ਕੇਨਸ, ਤੇ ਦੂਸਰਾ ਤੁਸੀਂ ਇਹ ਚੈੱਕ ਕਰਨਾ ਜਦੋਂ ਤੁਸੀਂ ਖਲੋਂਦੇ ਹੋ ਕਿ ਤੁਹਾਡੀ ਜਿਹੜੀ ਕੇਨ ਹੈ ਸਹੀ ਤੁਹਾਡਾ ਸਾਈਜ਼ ਕੇਨ ਦਾ ਹੈਗਾ ਜਿਹੜਾ ਤੁਹਾਡੇ ਇੱਥੋਂ ਤੱਕ ਹੱਦ ਤੱਕ ਆਉਂਦਾ ਹੈਗਾ ਜਦੋਂ ਤੁਸੀਂ ਸਿੱਧੇ ਖਲੋਂਦੇ ਹੈਗੇ ਹੋ। ਦੂਸਰਾ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਜਿਸ ਤਰ੍ਹਾਂ ਜਦੋਂ ਹੱਥਾਂ ਦੇ ਕਈ ਲੋਕ ਜਿਹੜੇ ਜ਼ਿਆਦਾ ਕੰਮ ਕਰਦੇ ਨੇ, ਕੈਸ਼ੀਅਰ ਦਾ ਕੰਮ ਕਰਦੇ ਨੇ ਜਾਂ ਜ਼ਿਆਦਾ ਹੱਥਾਂ ਦਾ ਉਹਨਾਂ ਦਾ ਪ੍ਰਯੋਗ ਹੁੰਦਾ ਹੈ, ਤਾਂ ਉਹ ਰਾਤ ਨੂੰ ਇਹ ਇੱਕ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਇੱਕ ਹੈਲਪ ਲੈ ਸਕਦੇ ਨੇ, ਇਹ ਪਾ ਕੇ ਜਿਹੜਾ ਗੈਜਟ ਹੈਗਾ ਇਸ ਨਾਲ ਤੁਹਾਡੇ ਹੱਥਾਂ ਨੂੰ ਰਾਹਤ ਮਿਲਦੀ ਹੈਗੀ ਹੈ ਅਤੇ ਉਹ ਜਿਹੜੀ ਦਰਦ ਹੈ ਉਹ ਘਟਦੀ ਹੈ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਨੀ ਕੈਪਸ ਬਾਰੇ ਵੀ ਇਹਨਾਂ ਨੇ ਗੱਲਾਂ ਬਾਤਾਂ ਕੀਤੀਆਂ। ਸੋ ਜ਼ਰੂਰੀ ਨਹੀਂ ਕਿ ਦਵਾਈ ਖਾ ਕੇ ਹੀ ਤੁਸੀਂ ਦਰਦ ਖਤਮ ਕਰਨੀ ਹੈ, ਇਹਨਾਂ ਚੀਜ਼ਾਂ ਦਾ ਵੀ ਸਹਾਰਾ ਲੈ ਕੇ ਤੁਸੀਂ ਦਰਦ ਨੂੰ ਘਟਾ ਸਕਦੇ ਹੋ।